Hi, Dr. Haider Ali here, pulmonologist. Welcome back for the next video. So today I want to spend a bit of time talking about seasonal change as we're getting into this colder weather now. We decided to make this video today because I think winter is a very challenging time for people who have lung disease. And I see this in my own clinic. We see a lot more patient visits, sick visits, because people are having a lot more trouble with their symptoms in winter and fall. And so I thought this would be a good video just to give you an idea of things you can possibly do to, to preserve your health and just be aware of really. What happens in winter, the most obvious thing is that the weather is cooler, right? So we don't spend as much time outside. We congregate together more indoors. And so that obviously has implications for viruses which may get passed around because we're in closer proximity to each other. But also the allergens in the air, inside the house, outside the house, they're changing as well. And that's something we'll talk about. But also I want you to just think about things like vaccines and how you can prepare, for any sickness which may come your way. So we'll talk a little bit more about each of these as we go through the video. Okay, so the first thing you'll notice is that the weather's getting cooler, right? So wherever you are in the country, if you're watching this from the US particularly, that the weather is cooling down. Depending on where you are in the country, what's in the air is also going to change. So the humidity is probably going to start to go a bit lower. And you'll start to notice a lot of allergens in the air, which are changing from the summer and springtime. So where I am based in the southeast of the US, we're starting to see a lot more ragweed coming up. We're also seeing a lot of other weed pollens, and there's some grass pollens which actually can persist beyond the summer, like Bermuda grass. And to keep an eye on these counts, you can use either a weather app or a specific allergy app, which can tell you what's in the air. The reason why that's important is if you know you're allergic to ragweed or mold spores, which is another big one at this time of year, you may not want to plan something outdoors, even though the weather can be really beautiful this time of year. Just be careful about spending a whole day outdoors where you'll be exposed to something which is going to potentially aggravate your lungs. So think about that. Other allergens that can start to increase this time of year are certain tree pollens like elm trees, pine trees. And so you may notice again, like if you have sensitivity to those pollens, you may start to have more symptoms, either cough or an irritation in your throat, itchy eyes, runny nose, or you may just feel a little bit more breathless than normal. And these can you'll see these probably mid to late winter as we approach the very earliest portion of springtime. So probably not yet, but something to keep an eye out for as well. We also see cedar and juniper tree pollen as well at this time of year. So that's another one that if you know you are sensitive to that, that can definitely irritate your airways at this time of year. The other thing that you should think about is when it's winter, when it's cold, we spend more time indoors. And so we're going to be more exposed to any allergens inside the house. So particularly dust mites are very, very common. We get them almost as clean as your house can be. You'll still have dust mites, and they tend to proliferate in bedding, in upholstery, in sofas, mattresses, things like this. So as much as like I said, you can keep the house dust free, you will have dust mites, and because you're inside more, you're probably going to have more exposure to those. So that's something to think about. It's always a great idea to make sure you're changing your filters on your air conditioning and your furnace to make sure that those should be changed once a year, just to make sure that you're not getting a buildup of dust and reducing the effectiveness of filtering the air in your house as well. So that's important. Some people also at this time of year use humidifiers to combat the very dry air in the wintertime. And it's important when you have a humidifier, that's great, but you've also got to make sure that it's well maintained. So make sure there's no mold, any water in there is being cleaned out, and the machine is operating effectively. What we don't want is there to be a reservoir of mold that's then being pushed around the room or the house. So other indoor allergens which can irritate you might be pet dander. So if you have cats, dogs, and you're spending more time with them, their coats may be changing as well. And so you may notice, again, if that's something that you're noticing your symptoms are worse in the winter, could it be that you're spending more time with pets? And the last thing is mold inside the house can be an issue as well. any sort of damp environment you have in your house, whether it's a bathroom, a kitchen, a wet room, or basements, if you see any visible sort of black spots or mold, that can be something to get to get a contractor to come and look at, because especially in basements, if there's been water damage down there, you may have a mold issue. So just keep an eye out for that. Keep a watch for that sort of musty smell, which you may get in basements. But as it sort of gets cooler, as it may rain more, we may start to see some issues in the basement, and that's really can impact your health, depending on where you spend most of your time as well. Oftentimes, we are exposed to mold all the time, so it's not something that we all have issues with, but some people are more sensitive to mold spores. And even if you can't see any visible mold, there can be mold in the house. So make sure you keep things as ventilated as they can be. That's all you can really do, but keep an eye out, make sure the basement is well maintained. All right, so the first section we're going to talk about is vaccines. So vaccines is a hot topic. It has been probably since the pandemic, really, but it's something that's important. I think there's a lot of different information about vaccines online on the news and things, but I want to tell you kind of where I see the role of vaccines as my role as a physician, and particularly as a pulmonologist. So I think everyone should get a flu shot. Now influenza is a winter virus. It peaks predominantly in winter, but we have seen summer peaks as well. And what we do is the flu shot, the actual vaccine is designed based on what caused flu in the southern hemisphere the season before. So this summer that just passed was winter in the southern hemisphere. And so vaccine manufacturers looked at what happened there, what was the predominating strain of flu, and then they make a vaccine to protect everyone in the northern hemisphere from that particular strain. So because of that that explains why year to year the flu vaccine is not always 100% effective, right? Because sometimes the strain that was in the southern hemisphere mutates a little bit, and so the vaccine that we've designed here in the northern hemisphere doesn't give us full protection. Nevertheless, though, it is a very important vaccine to get, because flu can still kill you. It can still put you in hospital. We've seen a lot of deaths and people hospitalized with influenza. And so for that reason, for the cost of a bit of an achy arm for a couple of days, I'm feeling a bit tired, I think it's definitely worth it. And I just got mine last week. So please go out and get your flu shot. The next vaccine I think people should look at getting, if you're eligible, is the respiratory syncytial virus vaccine, or RSV shot. Now, RSV is another nasty virus. It peaks in winter, and it can hospitalize you. It can kill you. We've seen people, particularly with asthma and COPD, get some very, very bad bronchitis with, causing low oxygen levels, and can make you feel very unwell. The great thing about the vaccine is that it's really effective. You get it once, and it should last you, even at 3 years after that shot, you have about 70% immunity to RSV. So it's not an every year thing, but I do think if you haven't had it, speak to your doctor and see if you would be a good candidate for it. As it stands in the US, you have to be 60 years or older to get it, or you can be 50 and older but have a comorbid condition. So speak to your pulmonologist or primary care doctor. But generally, you can get that without a prescription in the US, as you can with the flu shot. Okay, the third vaccine is the pneumonia shot. Now, the pneumonia shot is a vaccine that there's been a few iterations of this vaccine, and the most recent one is Prevnar 20 at the time of this video. It's a one-time shot that should protect you from anywhere from 5 to 10 years. So again, it's a one and done for a little while. Now, the misconception is it protects you from ever getting pneumonia, all types of pneumonia. Now, we know that there's loads of bacteria that can cause pneumonia, and the one that this is protecting you against is the most lethal one, which is Streptococcus pneumoniae. This is a bacteria that can cause pneumonia, it can cause meningitis, it can cause really bad throat infections, skin infections. So it's protecting you specifically against this infection from this bacteria. That's not to say other bacteria can still affect you, and cause pneumonia, but this is a big killer, and so it's really important to get this one. Again, it's Generally, if you have a lung condition at any age, you should be able to get this. But otherwise, for healthy people in the population, 65 and older is when it's generally indicated. Now, the final vaccine is COVID-19. Obviously, has had a lot of media attention over the last few years. Now, COVID-19 vaccine is, I think it's in the way I'm sort of telling my patients is generally if you're over 65, we know that your antibody levels are going to fall, much quicker than other people in the population. So I would recommend getting a vaccine. And I think also people who are immunocompromised, so if you're a cancer patient or you're taking drugs which weaken the immune system, I would definitely recommend getting the vaccine just to boost your antibody levels. That being said, I don't think it's necessarily going to stop you from getting COVID. COVID's a very, very infectious virus. It's going to be around every winter, so it's not going anywhere. And I think it's, even after the vaccine, there's a very good chance you'll get infected. But those populations, those people I just mentioned, immunocompromised, cancer patients, elderly patients, we know that your antibodies need a boost. So I would recommend that because I think it would hopefully enable you to have a much more smooth illness course. You won't be as sick for long and you won't get as sick. Now, if you remember, the reason we developed a COVID vaccine in the first place was because people were coming into hospital extremely sick and they were dying of COVID-19. We're simply not seeing that anywhere now, okay? So the rationale for healthy people to get a COVID vaccine is not as strong as it was a few years ago. And a lot of people, as long as you've had your initial vaccination set and one booster, you should be good if you're healthy and no other issues going on. But if you have specific health issues, please do speak to your doctor and see if you should pursue that. All right, the next thing I want to talk about in winter is exercise. So the weather's changing. You may have a nice window where the weather's beautiful outside and you can go and walk, and it's not too hot, it's not too cold. And sometimes for some people, depending on where you live, this is the best time of year to exercise outside. However, if you are in an area where it's very cold or you're unable to exercise outside, there's things you can do indoors, very simple things without needing a lot of equipment that can really keep you active and keep you moving through the winter. So things like marching on one spot is very, very good just at keeping your hips moving. It gives you good balance, things like that. You can also do exercises in a chair, for example, like arm circles or leg lifts. Or you can also use resistance bands when you're seating as well. So that's, again, resistance bands, you can buy them online, very, very cheap. And they're a great way just to keep your muscles engaged, and you can do that in a chair. If you can't, and the other thing you can do is just general stretching, right? If you have a yoga mat or just even a rug, you can lie down, you can do some stretching exercises. You can find some great videos online which show you like how you can stretch different parts of your body. And again, it just stops you from seizing up. It helps you just stay flexible as the weather gets cold. But if you can go outside, by all means, get outside. The fall time is beautiful. Early winter is beautiful. As long as it's not wet or icy, you can walk and hopefully the allergens won't cause too much problem. But please do stay active during the winter. It's really important. So another question I get a lot is, should I wear a mask or when should I wear a mask? And it's a good question. I think there's no easy and one answer for everyone. Why do we wear masks? Now, masks, just a simple surgical mask can stop us from, it basically filters the air, right? So any particles that are coming through that mask will be filtered out. And that includes many viruses or other sort of infectious particles, but also a lot of just air quality issues like particulate matter, pollution, things like that. It can help. Now, my rule of thumb is if you're going to be in an enclosed space with lots of other people and you're worried that you're the kind of person that will get sick or you're immunocompromised, absolutely wear a mask. If you're going to be in a well-ventilated space, and that can be an indoor space still, but if it's a well-ventilated space, you don't necessarily have to wear a mask. It's always a balance, right, between you want to live your life and socialize and do these things without feeling like you have to isolate yourself, but at the same time you want to stay healthy. And where you draw that line is to somewhat a personal decision. But there's no, 100% way you're going to prevent yourself from getting sick, and you just have to be a little bit sensible and rational about it as well. But masks for certain populations are very important. So listen to your oncologist or your rheumatologist or your pulmonologist if they're saying you have to wear a mask. But if you're generally healthy, there's no sort of strong indication to wear a mask. And just to add to that, one thing we learned from the pandemic in 2020 was that ventilation was actually more important than social distancing. So what I mean by that is you could stand right next to someone who had COVID-19, but if you were outside on a windy day, you're probably fine. Whereas if you were in a tiny room 10 feet away from someone who had COVID-19 and there was no ventilation, you're probably going to get it. So it's all about ventilation rather than actual distance to other people who are infected. So always think about how well ventilated is this space where I'm going to be, or if I'm going to go out for dinner or something, is there an option where I can sit outside maybe if the weather's agreeable? So that's another option. All right, the next thing I want to talk about is having an action plan. So if you're watching this and you have lung disease, just go to your cupboard or your drawer, look and see what medicines do I have, what inhalers do I have some antibiotics, do I have steroids if I usually take that if I get sick, do you have, stock up on, make sure you've got things like an expectorant, things like Mucinex or Robitussin, some of these medicines which may help you. Look at your inhalers, are your medicines in date, do you need to go and see your doctor and say, look, hey, winter's coming. Would it be worth me getting some antibiotics, especially if you're going to be traveling over Thanksgiving or the holiday period? So just make sure you have a look at everything and see, do I have everything I need right now? That's really important as well. And the final section I really want to talk about is the way the weather and the seasons can affect our mood. There is a condition called seasonal affective disorder where people's mood can definitely go down in the fall and winter. And a lot of that is due to loss of bright sunlight. The days often get shorter, so we're living more of our lives in darker periods of the day. The weather just getting cooler can cause changes in our body, and then the change in barometric pressure, atmospheric pressure, can affect things like arthritis, joint pains, back pains. It can affect people who have fibromyalgia and cause muscle pain. So all of these things, when they add together, you just don't feel as good. You may not feel like you have as much energy in winter and fall as you did in summer. So that's something just to be aware of, and to think, is there anything I can do to sort of boost my mental health during this time? Do I need to do some breathing exercises every day, or just do some mindfulness meditation? Make sure you're still engaging with friends and family, and don't sort of isolate too much, because this is a time of year which can affect all of us in different ways. All right, guys, I hope that video was useful. It was just a slightly different look. I want everyone to be prepared as we go into winter, and just some of the things you can think about to stay healthy. Anything I've said on this video is obviously my opinion. I want you to really go and discuss with your own physicians about what they think is right for you. But for many of my patients, these are the kind of discussions I'll be having at this time of year. And the goal is to keep everyone fit, happy, healthy, out of hospital, and functional, right? And you want to be able to do the things you want to do, travel, socialize, things like that. So I hope everyone has a great fall and winter, and I look forward to seeing you on the next video. So stay healthy, and I'll see you next time. Bye now.